This week, the 6th to the 12th of May 2024, is the first ever Trans History Week in the UK, launched by QueerAF as a way to collect, platform, and share the rich history of trans people. Healthcare is such a big part of trans people's lives, and the trans healthcare system is so important and has such a rich history that it should be shared and heard by everybody. From the first ever gender affirming surgery in 1922 to the creation of WPATH and beyond, everything in this video has been researched thoroughly by me, sources are cited throughout and linked in the description. If I've got any information wrong, please feel free to correct me in the comments. I appreciate any feedback. Obviously, there's only so much I can do to fact check everything, and there's only so much information out there. Our story today starts with the German physician Magnus Hirschfeld. Hirschfeld coined the term transvestite in 1910, which is defined as the desire to express one's gender in opposition to their defined sex. While this term is no longer used today, it stood as an integral starting point to bring recognition to trans people at the time. Hirschfeld started the Institute of Sexology in 1919 in Berlin. This institute was one of the first to offer hormone therapy and gender reassignment surgeries and was the forefront of gender research. At the time the Institute of Sexology was created, contemporaries wanted to cure trans people of what they believed to be a mental illness. However, Hirschfeld's adaptation theory sought to connect people living according to their nature with others of a similar mindset and supported those who wanted to live as a gender they felt most aligned with. This is shown when in 1927, Hirschfeld stated, "This is why the doctor must be replaced by people who bring the same understanding and tolerance to the patient, and whom the patient can confide in the same way as in the doctor. People with the same condition are very suitable in this regard, especially those who have already achieved a higher level of awareness." Hirschfeld's views towards gender were aligned with what we see today in regard to gender diversity. He believed that there are multiple gender expressions, all a mix of absolute male and absolute female characteristics. Hirschfeld even worked with the legal advisor of his institute to support the legal name changes of his patients. In 1933, most of the institute's work was destroyed in the Nazi book burnings, and Hirschfeld was forced to exile Germany. This was a tremendous loss and setback for trans healthcare and trans rights as a whole. While most of the research and documentation from the institute was lost in these burnings, it is believed that he was likely the first to offer gender-affirming surgery when he performed castration in 1922 on one of his trans employees. The institute's most famous patient was Danish painter Lily Elbe, whose story has been fictionalized in the popular film The Danish Girl. Starting in 1930, Elbe had 5 surgeries as part of her male-to-female transition. Elbe died from infection-related complications of her final surgery in 1931. Gender reassignment surgeries in the UK were pioneered by World War II surgeon Sir Harold Gillies. He is most famous for the development of a new method of facial reconstruction surgery in 1917. During the war, Gillies performed genital reconstruction surgeries on wounded soldiers. This gave him the experience he needed to be able to perform gender reassignment surgeries in the future. He performed the first phalloplasty in the UK on British physician Lawrence Michael Dillon in 1946. Dillon was transmasculine and had 13 operations over 4 years. Gillies requested no publicity for his gender affirmation work, stating, "If it gives real happiness, that is most any surgeon or medicine can give." In America, trans healthcare was introduced by Dr. Alfred Kinsey. Kinsey was a biologist who founded the Institute for Sex Research at Indiana University in 1947. He introduced the term transsexual, but due to its focus on the medical side of transition being what defines a trans person, this term is now outdated. The first American to undergo gender reassignment surgery was Christine Jorgensen, who traveled to Denmark to endocrinologist and surgeon Dr. Christian Hamburger. Jorgensen was very public about her story and even had a New York Times article published about her in 1952. Many other Americans wrote to Hamburger about their transitions, who referred them to endocrinologist Henry Benjamin, who had offices in New York and San Francisco. Benjamin had been studying transgender issues since at least the 1950s. In 1966, he released the book The Transsexual Phenomenon, which laid the foundation for modern transgender healthcare. He spent a lot of time with Hirschfeld and believed in the same principles. In the 1960s, Johns Hopkins Gender Identity Clinic opened its doors to patients to provide gender-affirming surgery in America. Over a century, it opened dozens of new clinics and helped a lot of trans patients. However, in 1979, a study by John K. Mayer and Donna J. Retter suggested that psychosocial outcomes in transgender patients who had gender reassignment surgery were not better than those without surgery. This study led to the closure of Johns Hopkins Clinic, despite backlash and criticism about the methodology of the study. Recent studies by Johns Hopkins Medical School and Harvard University found that the internal politics and pushbacks from leadership caused the clinics to close, and the previous study was false. The Johns Hopkins Center for Transgender and Gender Expansive Health opened recently and once again provides gender-affirming healthcare to those in need. Moving forward to 1972, the Center of Expertise on Gender Dysphoria was opened at Amsterdam University. This was one of the largest trans clinics and research institutes in the world, and it treated trans people of any age. The biggest improvements in trans healthcare came with the introduction of WPATH. In 1979, what was then called the Henry Benjamin International Gender Dysphoria Association, or the HBIGDA, was created. This was later renamed to the World Professional Association for Transgender Health, more commonly known as WPATH. In 2007, WPATH created the first version of Standards of Care for the Health of Transsexual, Transgender, and Gender Nonconforming People. Now in its seventh iteration, the WPATH Standards of Care provides guidance on everything from HRT to surgical interventions and everything in between. WPATH's primary objective is to promote the highest standards of evidence-based and ethical healthcare for transgender individuals. In 1980, gender identity disorder was added to the American Psychiatric Association. This phrase was very controversial, but it helped transgender people gain access to the healthcare system that they needed at the time. This wording was changed to gender dysphoria in 2013, as being trans was no longer considered a disorder. The Gender Reassignment Act was introduced in the UK in 1992 to provide legal recognition to trans people who had undergone gender confirmation surgery. Later in 2004, this was updated to the Gender Recognition Act to allow trans people to legally change their gender without necessarily undergoing surgery, although this is still a lengthy and difficult process in the UK today. In 2007, Charing Cross GIC, the first NHS-funded gender identity clinic for adults, was opened. It provides psychiatric assessments, HRT, and support for social transition. 10 years later, in 2017, the Tavistock Clinic, the first NHS GIC for trans children and adolescents, was opened. The NHS's GIC system has incredibly long wait lists, with GIDs being completely inaccessible currently. There is still a lot of stigma and debates around trans healthcare, especially for trans youth. The US government ruled in 2014 that Medicare must cover gender-affirming surgeries, given that they were no longer considered experimental. WPATH updates reference many studies that prove the effectiveness of gender-affirming healthcare for trans individuals. And this was a massive step forward for trans healthcare in America. Today, trans healthcare is still very inaccessible, with most routes being private care that a lot of trans people cannot afford. There is still a lot to be desired, but the medical techniques and procedures are there and forever improving. I, like everyone else, really hope that we see major improvements in the wait time and accessibility of trans healthcare in the near future. This is by no means a complete look at the history of trans healthcare. There is plenty more that can be explored, and if you are interested, I do recommend having a research into the topic. I've really enjoyed getting to research for and put together this video, and I know that I've certainly learned a lot about trans history, and I hope you have too. Thank you for watching, and hope you have a great rest of your day. Bye!